Hi, I'm Dr. Eric Kuelker, and I'd like to talk to you about my experiences using the Relationship Development Intervention Program developed by Dr. Steve Gutstein. And what really drew me into the program was the fact that I'm actually a clinical psychologist. And so when he talked about the difference between static intelligence and dynamic intelligence, that really resonated with me. The fact that kids with autism are very good at following static rules and static procedures, but they're very poor at shifts, dynamic shifts, and shifting attention and monitoring multiple channels of communication. So that was so much more meaningful for me than the model of ABA intervention, applied behavior analysis intervention. Because that model was developed back in the 1950s when honestly we had no idea how the brain worked. And this was a much more up-to-date explanation for how the brain worked and how to help remediate it based on current research, not research that was done literally 50 years ago. So that's the theoretical stuff. That's why I bought into it from a psychological perspective. The other side is the practical side. And I actually found that I did RDI about 3 or 4 hours a week with my daughter, so it was really manageable. It wasn't like 16 hours a week. It was about 3 to 4 hours a week that I would dedicate to RDI. And the results were amazing. When we started off, my daughter would lay on the floor just tensing and groaning. She had few words. She certainly couldn't hold a conversation at all. She even had a twin sister, and they didn't play together. Seriously, they shared a womb. They even shared a room, but they didn't play with each other. And shortly after we started doing RDI, lo and behold, the twins would spend hours playing with each other, and it was so charming to watch. And just last week, my daughter, she's nearly 16, I was driving her home, and one of another girl exactly her age. I was driving them both home and dropping my daughter off at the church and this other girl off at her house. And you know what? I was listening to the conversation between the two, and the way my daughter interacted with this other girl, exact same age, same school, sounded like a completely, totally normal conversation. Yeah, it sounded exactly like two teenage girls talking about the school play. And my daughter said, what do you think of the casting of the school play? And they talked about how the lead was very young, but she had a good voice. And my daughter says, I don't know why the other girls don't like Blake. He's a nice kid. And Zoe was saying, yeah, he's a good guy. And I listened to them talk and talk for 5 minutes. A completely ordinary, normal conversation was happening between the two of them. And this is standard for my daughter. She has a best friend. She's fully integrated in school. Her aide doesn't even work with her anymore. Or hardly ever, just occasionally there is a resource. She gets straight A's, and people like being around her. And actually, she wouldn't even meet the diagnostic criteria for autism if she was plunked in a room with a psychologist for an hour. Seriously. She's made so much progress. So for that reason, totally happy to endorse Wendy Groyce as our autism consultant. And the RDI program overall, I've seen it bring amazing changes from a child who wouldn't even play with her twin in the same room, just wandered around muttering bits from television shows. Now she's sitting with her peers, having completely ordinary conversations, fully integrated into school, and with a best friend who hang out with my daughter, and they yak and they talk for hours together. So if you're thinking about RDI or working with Wendy Groyce, go for it.